Welcome to sunny West Palm Beach, Florida, where Select Women's Healthcare brings babies into the world. Today we're going to go over the 5 top methods to achieve a successful vaginal birth. Some of you are going to just decide that one of these methods is your method and you're going to use that method the entire process of having the baby. And others of you may choose a little bit of each of these methods and put it in your birth plan, and no way is the right way. Each person has their own individual way of getting through this process, and these are just tips and helpful hints on how to get through so that you have your successful vaginal birth. So the first method we're going to go through is the Lamaze method, and then we're going to discuss hypnotherapy, hydrotherapy, the Bradley method, and then using medications, medicated births, such as using an epidural or having just IV medications added while you're going through the labor process. At the end of the video, I'm going to go over what I used to get myself through the 5 births that I had vaginally, and then I'm going to tell you what seems to me to be the most popular method out there that I'm seeing in my practice. I may be a little biased because of how I feel the courses are being taught, but we'll see at the end. I'll tell you what I think. So number 1, Lamaze. This has been around a long time, this method. I remember that was what was around during the time I was having my babies, and I used to teach Lamaze classes. In your course, you're going to learn how to relax and breathe. They take you through several different breathing patterns and methods of relaxation that you can utilize as you go through the labor process, because as labor progresses, the intensity of the contractions change, and so they teach you different relaxation and breathing methods to help you get through that whole process. So at the very end, they actually even teach you how to bear down and push the baby out, and you're given enough education at these courses to understand what's going on so that when it's happening to you, you're not as frightened. And I always feel that knowledge is power. The second method is the hypnotherapy method, and this is more for a person that's more introspective and finds comfort from within. And this method requires you to purchase the tapes, maybe go to a class and a course to be able to successfully achieve your goal, and then practice. So you have to listen to this tape, which has a woman on it that basically goes through several birth affirmations, and you get used to listening to her voice. And many people just put headsets on and listen to it as they are falling asleep at night, and then when it does come time to have the baby, the person is so used to this person relaxing them that they basically look like they are sleeping through their labor. We've had several patients that you would have sworn they were asleep, and then all of a sudden they start inadvertently like bearing down, and you pull back the sheet and the baby is crowning. So it's pretty amazing. But not everyone is able to do this type of method. You have to do the homework or you're not going to have a successful vaginal birth from this method. Our third method is hydrotherapy, and this method is very relaxing. It's so relaxing that if you're not really in active labor, then you should not get into the water. So timing is everything using the water method. And so our recommendation is to wait until you're approximately 5 to 6 centimeters dilated before you get into the tub of water. And water is very soothing, and the sound of the water, the movement of the water, it is all very calming. And the buoyancy of the water kind of takes the pressure off the uterus and allows the woman more comfort in labor. But the only problem is that it's so relaxing, if you use it too soon, then it'll stop your labor altogether. And many people are also delivering in the water, and it does take the pressure off the baby's head. And if done properly, it's a beautiful way to have your baby. Our fourth method is the Bradley method. This method is known as the father-led method. So it involves the dads, and it actually is very, very sweet to see the dads being a part of the birth experience and really getting involved into the actual nitty-gritty, right down into the, the sweat and the whole business. They're 100% involved. It's great. So anyways, here in South Florida, it's really very common to see. And in my waiting room, the dads will be like high-fiving each other, and I'm like, how do you guys know each other? And they're like, oh yeah, we were taking Bradley together. So it's really cute to see, and not only do they bond with their partners, but they also have like lifelong family friends that they make during these courses. It's a long course. It takes probably 10 weeks to get through the course, and during that time they learn all the ABCs of having a baby, and they know all of their partners' desires for what they want for their birth experience. So once a woman is in labor, she is so involved in the actual process of the birth experience that she's not always able to remember all the little things that she really thought would be a wonderful opportunity to have happen while she was having her baby. And the nice thing about having the dad involved is that he knows what she wanted, and since he's not experiencing the way she's experiencing labor, he's able to help keep the team united and to keep everybody on track on the way that his partner wanted to have the baby. So they are similar in, the Bradley method is similar in the method of Lamaze, in the sense that they teach you how to relax and breathe, but it also incorporates hydrotherapy in the method as well, and just relaxation. But it's really the two together, like united. And at the end of the birth, the lady turns to the husband or the partner and says to him, I could not have done this without you. And that is like the sweetest moment, because it's building family, and I feel like that's a major important thing, to be promoting families and unity. So the Bradley method, I think you can kind of guess, that's like one of my favorite methods of all. Our fifth method and final method is the medicated birth. So this is a very long, large topic. So I'm just going to briefly discuss a couple points in regards to this. So epidurals are part of this method to help relax the patient. I had one patient who had decided, since she was already an RN, that she had already learned about epidurals, and she was actively working, and told me, I really am not going to take a course. This was her first baby, and she said, I'm 100% going to count on my epidural for getting me through this. I don't have time to take a class. But wouldn't you know that for us, I-95 is like the big highway. There was like a big pileup on 95, and anesthesia was all called into that hospital to help take care of the accident victims. And so there were no anesthesiologists available for an epidural for her for labor. And I had to teach them Lamaze, and in about 5 minutes she got the method down, we were rolling, and she breathed and relaxed through the last of the labor process, and that pulled her through. So you don't want to put all your eggs in one basket. I think it's wise to investigate and really look at the different methods and decide for you what's going to help. IV meds can also be a choice if you would like that instead of having the epidural. But in my experience, I really am leery of using IV medication because that seems to affect the babies the most. So you have to have a baby with no issues whatsoever, and also you have to be further along in the process because they only work for a short amount of time. So the two top medications that we add to the IV are Stadol and Nubane. And so these medications should be timed towards the end of the labor process, like approximately like when you're about 6 to 8 centimeters. because they're the best for about an hour, maybe 2 hours tops, and that will carry you to the point where you're going to push. But sometimes it makes the babies very sleepy because it's not localized like the epidural. The epidural just affects like your lower half of your body, and the IV medications are systemic. They're throughout your whole system, so it goes to the baby too. And you know, if we're concerned at all about the baby, I usually steer patients away from that method. But an epidural can also be a lifesaver. Just this past weekend, it helped save a mom that was possibly going to end up having a C-section because she was so exhausted. And so she got the epidural, rested for 2 hours, the baby came down in the pelvis, and we were able to have the successful birth that we wanted. And she used Lamaze and Hydrotherapy through the beginning of the labor, and then we used the epidural at the very end, and we had that vaginal birth. So my 5 children were all delivered vaginally and very successfully. I was blessed with rapid labors, and I see that now as a midwife and helping other people. I realize how blessed I have been. But I used Lamaze, and that helped me. But that was what was popular back then, and to be honest with you, I only could remember one breathing method throughout the entire process, except when it was time to push. But I only could remember the hee-hee-hoo. But I hee-hee-hooed 5 little fill-ins out. But then, you know, it was wonderful. It was, like I said, I was blessed. And my most favorite, I think you can guess, was the Bradley method. And that's because I just love how it helps build families. I think that that's awesome. I love it that it's not that the woman turns to me and says, oh my gosh, Kathy, thank you so much. I couldn't do it without you. I mean, of course, everybody loves to hear people, you know, give them all these kinds of accolades, but the more mature me feels that it is the better way to have the dad get that grateful look, and, you know, it's a life bonding event. So I'm not going to be, unfortunately, with these ladies and gentlemen all their lives, and so, you know, this is the perfect bonding for family. So I'd like to thank you for watching my video, and I understand that this is a large topic and multiple ideas and information is involved in all of this, and we only skirted the different methods. So if you would subscribe below and leave any questions or comments, I would be very happy to address those issues with you. And I hope to hear from you and hear about how you achieved a successful vaginal birth by using one of these methods. I want you to know that I am not a hippie, or I am currently not, or was a hippie, but I did used to teach the Lamaze class. Welcome to sunny Florida, here where Select Women's Healthcare does their business.